All right.
Yeah.
Yes, we can see everyone who's typing their requests now. So don't worry, we will be answering them as well. All right. So from the previous session, I just noted down a few questions that they asked us. Mhm. Okay, so there's someone who is completing their MBBS in China, and they're asking us if they would recommend, like if you would recommend, if they are looking at the internal medicine residency program, to do their internship in this country, or does it not matter at all?
Uh, that's a very good question. I think it's better if you have a chance to do internship in this country. I recently came across during the career fair held in the UA University recently. Uh, there was a candidate, an intern from Syria, who did his undergraduate medical education in China, and now currently he's an intern here in the private sector. Apparently, some of the private hospitals, I think Burjil, if I'm not mistaken, VPS Healthcare is accepting interns as well. So he's doing electives in Tawam Hospital Internal Medicine
Not yet.
because he is an internal medicine aspirant.
Mhm.
So it's preferable if you do your internship here in the UAE. It's a good experience. You will come across the departments. You will earn the recognition of the department. So it's good. It's a good opportunity if you want to do your internship in the United Arab Emirates.
All right. So, okay. As an internal medicine resident, since you have started your rotations, someone wants to know if you're confident in managing patients, that's emergency plus outpatient, versus in some other country you have trained. So, balance on how you take care of patients over here. How confident do you feel you are?
Medicine is the same all over. It's universal. It's built on experiences. The best example I can give is how diabetes was found is when the urine was sweet and, there were ants crawling over it. I mean to say, medicine is the same everywhere. It depends on hospital to hospital policies. So there are certain gray areas of your practice, but overall the knowledge and the practice is the same. Most of the government teaching hospitals practice evidence-based medicine based on their updated guidelines from various medical associations and health bodies. So in having said that, you can manage patients across the world after your training in this program. And I must say personally that it is making me a confident and competent physician, because compared to my first year of medicine residency, if I compare myself to how I was in first year and how I see myself now, uh, by God's grace, touchwood, I get good feedback from consultants such as such as able such for example, one consultant told me that I am able to anticipate the prognosis of the patient, and I was able to bring about the discussion of do not resuscitate on someone who is very frail with a lot of comorbidities, in which CPR is not an option. How I was able to think like that, I wasn't able to think like that last year, but how am I able to think now? And that's because of the program and my own investment in learning and time. So, with this experience, you can manage outside. Coming to the first part of the question, which is emergencies, you as an internal medicine resident will do, like any other core specialty like surgery or OB-GYN, you will do ER on calls. You will do 12-hour shifts wherein you will come across patient referrals from the emergency department requesting whether this patient requires admission or discharge. Can we have internal medicine to come and assess? You will come and assess in the ED when the patient is stabilized. If the patient is not stabilized, you will take the patient to the resuscitation area of the ED. And this is in all hospitals. You have a resus area, not just the basic treatment areas. You have the resus area. So if the patient is unstable, you tell them to take the patient to the resus, escort with the patient, discuss the case with the ED consultant, and says that I think it's 1, 2, 3, 4, 5. We need to manage in A, B, C, D, E. Having said that, so your cognition skills and your thinking, your algorithms will improve as you progress from year one to year four. I'm still, in the early stages of my program because I have just finished my year one. I am in the second half of my year two. So I am still learning, and I'm practicing what I've learned. So in time, inshallah, you will be competent.
Perfect, perfect. That actually sounds really enlightening as well for all the aspirants who are trying to look at this program. One other thing someone else asked us is: are there any exchange opportunities between residents in Dubai hospitals versus residents in Abu Dhabi hospitals? Do you rotate in hospitals there, or is there something like that?
No, Dr. Mustafa. If you're an internal medicine resident in the Tawam Hospital program, you will rotate in your first 3 years of your residency in Tawam Hospital. In your year four, you have electives. I think about 4 to 5 electives in your year four. During your year four, you can choose what subspecialty you wish to practice, or if you like to practice core internal medicine, you can practice in Cleveland Clinic, Abu Dhabi, Sheikh Shakhbud Medical City. You can practice in Dubai also if you want. Even you can go abroad and practice if you want. I mean, it's elective. You do what you like based on what you do, what you want to do in the future. So you have the option of electives. um, During your first 3 years, you have one block, which is your annual vacation block. I humbly suggest you use that for your vacation because it is a taxing environment. It's a hard working environment. So if you wish to do your electives, do it during your fourth year of the residency program.
All right. One other thing is, as residents, are you allowed to present your researches in the conferences, and are you allowed to attend workshops?
Absolutely. Without hesitation, without question, you are allowed, you are rather obliged or rather entitled to do so. Just recently, we had a rheumatology meet. I personally wasn't part of that. I did not attend as a delegate, but one of my co residents from my batch, she was given the opportunity to present a rare case report in the a rheumatological case in the rheumatology conference. We have the upcoming annual Tawam Research Congress in the Tawam Hospital. So, a lot of candidates, including myself, we are working on case reports and various other projects to make sure that we have enough material to present for this event. And if you have the material presented, people are happy if you do it. I mean, they want you to be good residents. So you are entitled, you have the right to present. It's not, there is no need for any apprehension or hesitation. You have a project you want to present, tell your program that you want to present, and they will allow you to present. They will support you.
So this is a very good learning opportunity and curve as well for students, because they're not limited to a certain boundary. They are allowed to step further and enlighten themselves with the ongoing researches or even opportunities. That's wonderful. Uh, there is someone who asked, what MRE scores do you feel are feasible enough when applying for internal medicine residency? Do you have any idea for that? Any range that you feel should be good enough?
So try to keep an Emory percentage score as high as possible. I think I can give a blunt answer because it's better if you get above 80%, preferably above 85, but they will also look at your percentile rank. Uh, so, the exam that I give, and Emory, the level of difficulty varies. To be honest with you, unfortunately, there is no set standard level of difficulty like the PLAB exam, the Canadian exam, or the USMLE, or even the Indian exams. Uh, the level of difficulty sadly varies from time to time. So, whatever exam you are giving, just prepare, do your best, solve the past paper, solve U World. Those are the two main resources that many candidates have used. So, do that, practice past papers, U World, give the exam, and leave the rest to God. Uh, if I can share something from my personal experience that would release the tension of the listeners, I got a percentage that was close to about 80, but my percentile rank was above 90. The exam was very difficult. So I performed far better than those who sat with me in the exam, and that makes a difference. So just do your best and leave the rest to the Almighty.
Perfect. That sounds enlightening as well. And as you mentioned, the resources as well, I think they all can go through it. Since it's a competitive exam, nothing clear. It's just all touch and base on how you know your medical school knowledge. So I think people can really figure that out well now. Uh, as you said, an preferable score for Emory is required. However, if someone does not make it to the edge of that score, how else can he strengthen his application?
I'm sorry, Dr. Mustafa, I lost you in the second part. If someone is not able to reach the benchmark of the exam,
How else can he make up the application? Like, what else can he do to, just overcome that mark? Because Emory is not the only criteria that they get selected for.
absolutely, 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 yes, very much so. I'm glad that this question was raised during this meeting. To answer that question, I have to say you must do other activities to upscale your CV, such as what? All right, so you did not get a good score. Fair enough, you did your best. Hard, hard luck, but it's not the end of the road. There are other options to upscale your chances of getting selected and your chances of standing out. For example, GP experience is one. That's a lengthy option. If you want to do something short term to upscale your CV, any research projects, any ongoing research that you can be the co-author, that you can be a part of the co-authorship. That's one. Two, any case reports. Three, any extracurricular activities like campaigns, any leadership programs that you are taking part of, like, for example, Toastmasters or any leadership program that you are engaged in. um, Teaching assistant jobs. Many of the candidates who have applied to residency programs here as well as other areas in the UAE, they had been teaching assistants in the past. So all of these small mini experiences and workshops and research experiences can help you improve your CV and increase the likelihood of getting accepted for the interview. Because marks, my father used to tell me, and I keep telling this to myself and to my peers, my co-peers and my juniors, that mark is just a number. You get a good mark, good for you. You got a bad mark, still good for you. There are other ways to improve yourself. So it's not the end of the road.
Perfect. I think we have touched the end of our session today. It was really, really wonderful. I mean, a very in depth insight about the program is what all our aspirants would want it to hear. And I feel everyone has got that type of information today. Thank you so much for making time from your busy schedule, Dr. Shriram. It was wonderful having a session with you.
Thank you so much, Dr. Mustafa. Thank you for inviting me, and I must say the honor is mine to be invited into this meeting and to help the aspirants, who wish to practice in the UAE, especially to those who are internal medicine aspirants. I just want to say that if ever we happen to work together, I'm always around to help you, and if needed, I those who wish to get in touch with me, I am available. I'm allowing myself to be reachable to those who wish to take part, those who wish to enter into the internal medicine residency program in Tawam, and to those who wish to practice internal medicine. I'm open to suggestions, and I'm approachable. Thank you so much for
Per-
having me here.
You're welcome, and
Ramadan Kareem to you as well, and to everyone here. Sorry, doctor. I lost you in the middle.
no worries. I was just, sending greetings for
Sure,
Ramadan for
sure.
everyone since it's blessed. And I hope everyone who's fasting makes it safe and sound, does not put work into
Inshallah, inshallah.
chaos.
Maybe you all get good
Not fast.
blessings, and inshallah,
Yeah. Hopefully, the month of blessing is blessed for everyone.
inshallah. Thank you so much, Dr. Mustafa. Thank you. Take care. God
You're
bless.
welcome. Thank
Thank
you,
you.
guys.
Thank you. Bye bye.